Most patients with Parkinson's disease are over the age of 40. 5% are under the age of 40, and obviously just under half of those will be women. So this really raises the question of what about childbearing age and the fact that some women with Parkinson's may indeed get pregnant. People are often concerned with pregnancy about what medications are safe, and so the question is, do we have any good data that might help you if you're a younger onset patient who is considering a pregnancy with your Parkinson's, for example? Now, until very recently, I think it's fair to say that we had just a few case reports here and there, and the general message from those was that there seemed to be no increased problems with Parkinson's patients during a pregnancy. But I'm relieved to say that just very recently there has actually been a publication of a case series. Now, a case series generally doctors like to see hundreds or maybe thousands of patients in there to help guide us. I think this case series had 10 women, which, if you think about it, isn't a lot of women, but if you think about how many women with Parkinson's will get pregnant, it's actually quite a large series. I think it's somewhere in Europe, maybe Czechoslovakia, that had this study. The outcomes of that study suggested that, by and large, there are no problems with taking your Parkinson's medications. It didn't appear as though there were significant complications from the pregnancy itself. I think there was one miscarriage in that series, but in actual fact, I think these patients were older women, and as we know, that the age of pregnancy generally puts up the risk of things like miscarriage or other complications. But I think the general advice for somebody who is of childbearing age with Parkinson's disease is that all of the major classes of Parkinson medications appear to be safe within that population. In terms of breastfeeding, the bottom line is that there's no good data to support whether it's safe or not, but I think the obvious feeling when you don't know if something's safe would be to avoid that pattern of behavior. So I think, as I say, we can't be 100% sure that there are no problems with Parkinson's patients getting pregnant and then breastfeeding, but I think by and large the patients who do get pregnant should feel reassured by the data that we've got.